Welcome to the Coronavirus Weekly Brief. We're your hosts. I'm David Sterman.
And I'm Emily Schneider. Here are the headlines you need to know.
According to data from Johns Hopkins University, the global death toll from COVID-19 soared above 3 million on Saturday. Though vaccination campaigns are ramping up, virus hotspots continue to emerge around the globe in wealthier and less resourced countries alike. The United States leads the death toll, with at least 566,000 people having died, followed by Brazil with at least 368,000 deaths, and then Mexico, India, and the United Kingdom. Fast-spreading variants and loosening restrictions are driving surging case counts across the United States.
The Biden administration announced on Friday that it will spend $1.7 billion to detect, track, and fight contagious coronavirus variants. The money from the White House's pandemic relief package will support and streamline genome sequencing of the new variants. Quote, "This is part of addressing an immediate need, which is the COVID sequencing to get ahead of the variants," said Mary Lee Watts of the American Society for Microbiology. She continued, "But it also helps to build really an infrastructure for the future so that for the next pandemic, or something even like annual flu, other infectious diseases, we're really building a workforce that can partner with public health and meet the need," end quote. New fast-spreading variants are causing surges in COVID-19 cases globally. Research from Brazil this week found that the P1 variant may be twice as transmissible as earlier forms of the virus.
Dr. Anthony Fauci said Sunday that he suspects the one-dose Johnson & Johnson vaccine, which health officials recommended suspending over concerns about rare blood clots, will be back in use in some capacity after a vaccine advisory committee meets to discuss the evidence this coming Friday. Fauci predicted that health authorities will recommend age or sex restrictions on who can get the J&J shot. All causes of rare blood clotting side effect have occurred in young to middle-aged women. Quote, "I don't want to get ahead of them, but I believe we'll be back with some sort of indication a little bit before the pause," he said on ABC. The panel may not, however, be able to make a conclusive statement by Friday because of a lag in collecting data on blood clots in J&J recipients.
These rare blood clots, which have also been linked to the Oxford AstraZeneca shot, are part of a reaction that experts have dubbed vaccine-induced immune thrombotic thrombocytopenia, or VITT, which is marked by clotting and low platelet counts. According to recent research, both Johnson & Johnson and AstraZeneca recipients who experienced VITT had antibodies to PF4, a protein that helps platelets make clots in their blood. This may point toward a rare immune response in which the body attacks PF4. As research on this rare reaction moves forward, state officials worry that the longer the Johnson & Johnson pause lasts, the more Americans' mistrust of COVID-19 vaccines will amplify.
Ontario announced sweeping new police powers in order to enforce an extended stay-at-home order, as the province's coronavirus case numbers have spiraled out of control. There is growing worry among experts that the healthcare system is being pushed to the brink, so police in Ontario will now be able to stop drivers or pedestrians and ask for their address and reason for being out. Residents could face fines up to 750 Canadian dollars, about $600 US, if they don't comply. Checkpoints will be established on provincial borders with Manitoba and Quebec to stop non-essential travel. Quote, "We're losing the battle between the variants and vaccines," Ontario's Premier Doug Ford said on Friday as he announced the new measures. Quote, "We're on our heels. If we dig in, remain steadfast, we can turn this around." Ford also announced restrictions on playgrounds, camping, and outdoor sports. The new measures faced an immediate backlash from civil liberties groups. Quote, "Blanket powers for police to stop vehicles like this bends our constitutional freedoms too far and will cause a rash of racial profiling," Michael Bryan of the Canadian Civil Liberties Association said in a statement.
The capital of India, New Delhi, recorded 25,500 coronavirus cases in a 24-hour period, meaning about 1 in 3 people tested had a positive result, according to its chief minister, Arvind Kejriwal. He said on Sunday that less than 100 critical care beds were available across the city of more than 20 million people. Kejriwal told a news briefing that the positivity rate had increased to 30%, up from 24% in the past 24 hours, and that hospital beds were filling up fast. The city government said in a separate statement that it had informed Prime Minister Modi's government about the dire need of beds and oxygen. India reported 261,500 new cases on Sunday across the country.
Vaccine supplies are also dangerously low in India, with at least 5 states reporting severe shortages and asking the federal government to take action. Last week, more than 70 vaccination centers in Mumbai had to close due to a lack of vaccine doses. India is a major producer of vaccines, and the Serum Institute of India, SII, is the world's largest vaccine maker. Last year, SII agreed to manufacture up to 200 million doses for up to 92 countries under COVAX, the Global Vaccine Sharing Initiative. But now, with India in the midst of a second wave, SII has shifted its focus to domestic production and will delay deliveries to COVAX.
As the slow pace of vaccination in other countries generates frustration, some American expats are returning to the United States to get vaccinated. Many U.S. citizens abroad see the long journey home as worth the risk, expense, and time if they are able to get vaccinated months before they might otherwise be eligible. However, for some expats, concerns about how getting vaccinated in the U.S. might affect their ability to get local vaccine passports in other countries have led them to choose not to return.
To see our daily brief, go to the address in our show notes and follow us on Twitter at NewAmericaISP.
The Coronavirus Weekly Brief was produced by Shannon Lynch and Jason Stewart and was edited by Shannon Lynch. This podcast is brought to you by New America and Arizona State University.